use these expressions like watchful waiting, active surveillance. They're coined expressions. What are we waiting for? In other words, how are we being watchful? What are we waiting? Does that actually tell people that we're really waiting for something bad? I mean, if you're waiting for something bad, then why not take care of it now? So I think it's perspective, and it's the psychology and the wording that we're using that really is kind of askew, and perhaps maybe we do need to reassess of how we actually describe it, discuss it, and actually give the image to patients of a different approach, that observation is treatment, as you said, and I think that's a very, very apropos statement, and that we really need to have a more confluency of thought.
Well, I think you're absolutely right, and 10 years ago, everything was called watchful waiting, right? So it was only recently did this cool new term of active surveillance, because then you're doing something. You're following up with biopsies every 3 to 6 months or yearly, so that you're an active participant in this sort of waiting process. So the doctors changed the terminology to help it be more something that patients can have control over. But so now at least when I go to scientific meetings and whatnot, we don't say watchful waiting. They're all active surveillance or active surveillance cohorts versus active treatment. So yes, in some ways defining that term is a good one, but not only in just the observation arm or treatment. In the world I'm in, years ago, we used to call a person who failed hormones and had disease that was spread as hormone refractory. And then somewhere in there, the lab scientists said, well, that's not that great. So let's change that. So then it all became androgen independent. So then if you look at all the literature, it all changed to that. We're like, well, what just happened? And then more recently, now everybody's called castrate resistant. If you sum up all of that and you look at our giant literature base, it all basically means the same group of men. But we changed the terminology in that case to reflect the biology of the tumor, but the terminology for the patient got worse. Every time I say to a patient of mine, hey, you're in that castrate resistant, he's like, I hate when you use that word castrate. Can you not use that word? It was much better when it was hormone refractory. I got that. But terminology is a huge part of how you feel about your treatment, how you feel about yourself, how you feel about surviving the treatment. So I think we have to be very careful in how we move forward, especially now in the era of precision or personalized medicine. Now it's become, what about you, and what's your status, and what does that mean? And now all of a sudden you're like, oh goody, now I'm a gamish of 30 printouts, and that's what I am. So now that it will, just as a heads up, terminology is going to change again.